Hey everyone, welcome back to the Home of Veteran. A couple months ago, I created a video regarding a conversation that I had with my doctor and I about AI listening in on our appointments. And I wanted to create a follow-up video because I was going through the VA's news site today and looking at all their bulletins. And one of the bulletins basically was announcing that they are officially rolling out Ambient Scribe, which is their AI transcription tool, to all the primary care clinics across the country. Back when I recorded my original video, this was more of a pilot program, and my doctor and I were discussing it, and he felt that it wasn't really worth it to have this transcription program because he actually was spending more time reviewing what it was transcribing and making corrections and edits than it was just quicker for him to just do it the old-fashioned way that he's been doing for years. Well, again, now based on the bulletin that came out this morning from the VA, this is the end of July of 2026, they're now rolling this out nationwide. And so I wanted to create this follow-up video to kind of let you know what this Ambient Scribe is, and should you or can you opt out of it. So real quick, Ambient Scribe is a transcription program that's driven by quote-unquote AI, and it's basically a microphone in the exam room, and it listens in on the conversation between you and your doctor, and it is supposed to basically transcribe everything your doctor says and you say during your appointment. It then creates a draft note for the visit, and then your VA doctor is supposed to go in and review the note and make whatever changes are necessary, and then they can effectively save that note into your actual medical records. Now, I've been in the IT industry for almost 30 years, and I get asked all the time about AI and what I think about it, and that. I think AI is great for some things, and it's very scary for others. In this instance, I think it's both. I think having a tool that can make the doctors more efficient and make the records potentially more accurate, I think is a good thing. However, knowing what I know about AI, and it's not perfect, and it does make mistakes. And while, yes, the doctors still own that note in your file, in other words, their signature is on that note, I think over time, doctors are going to get complacent, and they're just going to hit approve without really proofreading the note fully to make sure it's accurate. The other concern that I have is AI can sometimes make up things or substitute things. And because this particular AI, and I don't know a whole lot about Ambient Scribe, but because it's in a medical environment, I'm sure it's been trained on medical terms and medical phrases. And my concern is it's going to translate statements that you as the veteran might make to your doctor and switch them up and make them sound different or make them sound more clinical. Also, it's possible it could misinterpret things that you're saying based on its training. So for example, if your doctor says, well, how's your back pain today? And you might say, well, doc, the pain comes and goes. And well, the AI might interpret that and say, well, veteran says pain is, it's occasional or something like that. Make it not sound the way that you wanted it to come out. And so, again, this is one of the fears that I have. And because it goes into your official medical record, this could affect disability claims and those type of things that you may have going forward. Because again, it's using these notes. So what I would encourage everyone to do, that after every appointment that you have, you need to go in and make sure that you go to your Blue Button medical report on the VA site and go through all of your clinic notes and make sure they're accurate. And do this within a few days of your appointment. The VA claims your records are available within 3 days, 3 business days, I believe. I've seen my clinic notes show up within a day. We don't know for sure exactly how long it takes, but I would give it 2 to 3 days. And then if you find errors in your records, you need to try and get those fixed right away. I have found the best and most efficient way to get records fixed at the VA, or anything done with the VA, is actually through secure messaging. But that's just me. Now, I do know that there's an official process to have your records changed, but I think that's more, maybe not clinic notes, but more of actual diagnosis and those type of things. Again, do your own research and find out how you can get your records corrected. Now, the big question is, do you have to use this or agree to this AI? The short answer, according to the VA, is no. You can opt out. So what's supposed to happen is, when you go into your appointment and you sit down with your doctor, they're supposed to tell you up front that your visit is being transcribed by AI or recorded by AI. And you have the opportunity, and you have the patient right to decline it. You can say, "Doc, I'm not comfortable with AI listening in on this. I do not want this transcribed. I'd like you to do it the traditional way." And they're supposed to have it turned off or not use it. Some doctors will probably be okay with that, but I can also expect that some doctors are probably going to get pissed off that you declined it, because now you're basically creating more work for them. So, it could be a good thing, could be a bad thing, but you're supposed to be allowed to opt out of this. And also, according to the press release this morning, you're also supposed to be allowed to opt out even in the middle of the visit. So halfway through the visit, if you decide you really don't want to have to use this, you're supposed to be allowed to opt out of it. So, again, is this a good thing or not? I would say yes and no. I think time will tell to see how accurate it truly is. Personally, again, as an IT professional, I don't have a whole lot of faith in it, but maybe over time it will get better and better. We'll just have to see. So anyway, just wanted to throw out a quick video on this, just to kind of try to keep everyone informed. If you are fearful of the AI, or if you don't want it to be used, opt out of it. Simple as that. Make sure you share this with any veteran that you know, because I can tell you there's going to be a lot of veterans that aren't going to be aware of this. And they're going to walk into their appointments and go, "What are you talking about?" Or "What do you mean it's recording?" I know some old school veterans are going to be like, "Heck no, I don't want this in my, technology in my stuff." So anyway, make sure you share this, and do all the other cool YouTube stuff that they do, like, subscribe, and all that good stuff. It actually does help get the word out. And I guess that's it. So I'll see you on the next one. Thanks.